Hi, I'm John Morse, and this is the male reproductive system, or MRS. So, you have internal and external genitalia. The internal is the testes, which produce sperm. Then you have the epididymis, which matures sperm, which is right here. Then you have the ductus deferens, which is this guy that goes all the way around here, which is a tube connecting the epididymis to the seminal vesicles, which are right here. The seminal vesicles secrete yellowish secretion that constitutes 65 to 75% semen. Then you have the prostate gland, which is right here, and that produces a milky secretion that constitutes 25 to 30% of semen. Then you have the bulbourethral glands, which produce pre-ejaculate fluids to lubricate the head of penis and neutralize the acidity of female vagina. Then you got the external part, the penis, which serves to deposit semen in the vagina, made up of shaft and glands, which is the head, and 3 muscles. You have 2 portions of corpus cavernosum and 1 corpus spongiosum surrounding the urethra. These serve to maintain erection and expel semen and urine. Then you have the scrotum, a pouch of skin containing testes, and it functions to protect the testes and regulate their temperature. They relax and contract to keep sperm around 35 degrees Celsius. So the functions of the male reproductive system, you got puberty, ages 10 to 12, and that's the growth of sex hormones, sperm production, generalized body growth, sex drive, pubic, axillary, and facial hair. It also does hormone control. So you have 2 pituitary gonadotropins, follicle stimulating hormone, luteinizing hormone, inhibin to suppress follicle stimulating hormone, and testosterone, which is secreted by the testes. And it controls all of those hormones. Then you have reproduction. It goes from the process of sperm development to sexual intercourse to sperm implantation into the ovum to fetal development. And then you have andropause, which is the slowing of testosterone levels as a male ages. And then you have some common disorders here: erectile dysfunction, low sperm count, and testicular and prostate cancers. Some risk factors for these problems: erectile dysfunction, diabetes, heart disease, obesity, smoking, and mental health disorders. Low sperm count can be from smoking, alcohol consumption, illicit drug use, obesity, exposure to heat, toxins, and radiation, or hormonal imbalances, genetic disorders, STIs, aging, infections, surgery, and medication. And then you have testicular and prostate cancer. The risk factors are age, family history, race, HIV and AIDS, and undescended testicles. Some age-related changes to the male reproductive system. Starting at age 40, your levels reduce, your testosterone levels reduce about 1% a year. And then obesity, alcohol, drugs can make this happen quicker. Men retain the ability to father children throughout their lives. Semen count, volume, and sperm motility decline as men age. Offspring of elderly men have a higher rate of miscarriage. And andropause is a term for these age-related symptoms. Info for nursing assistants about the male reproductive system. sexual needs continue throughout life. So you want to respect that and realize they have the right to express their sexuality. Knock before entering rooms. Provide privacy for the residents. If you do walk in on them, obviously close the blinds, get out of there. Don't make assumptions about a resident's sexual orientation. Don't be judgmental. And use residents' preferred pronouns and names. That's the work site.